watching KIDK Eyewitness News 3.
Come this midsummer, your neighborhood pharmacist will be able to do more than just fill your prescription. They will actually be able to write one for you. I talked to the people on the medical side and the pharmacy side to find out why this is happening and how it will affect you as a patient. It's only on 3. House Bill 191. It was passed by the Idaho legislature in the 2017 session. When the bill went into effect July 1st, 2017, it allowed the Idaho Board of Pharmacy to spend the next year determining what lesser drugs could be prescribed by a pharmacist. A patient would not need to see their doctor for a minor illness or ailment. The pharmacist could both write the prescription and fill it. To find out why the change, I talked with Dr. Jennifer Adams, the Associate Dean of Pharmacy and Pharmacy Law Professor at Idaho State University.
Well, the purpose of the State Board of Pharmacy is to protect the public health. And one of the ways that they see that we can protect the public health is to provide access to care for patients in our communities, especially those patients in our rural communities. And pharmacists are the most accessible healthcare practitioners that there are.
With an increase in accessibility as the overall goal, there could also be indirect benefits. A patient could potentially save money and time not having to schedule a doctor's appointment. For the doctor, this could allow them more time to focus on the more serious patients that need extra care. Still, pharmacists say this decision by the Idaho Board of Pharmacy and okayed by the legislature is centered around the patient.
From my standpoint, this is a very good thing because it benefits the patients.
Mike MERRILL has been a pharmacist since 1978 and is the owner of Mike's Pharmacy and Compounding Center in Idaho Falls.
The important thing is the patient. We want to see the patients. We want to see the patients live longer. These patients become our friends.
From the medical standpoint,
I think it gives pharmacists a lot of opportunities, but also new obligations.
Dr. Joseph Weatherly is a family practitioner at BINGHAM Memorial Family Medicine in Idaho Falls. One of his concerns would be keeping a pharmacist in check, just like a doctor.
The oversight that the Board of Pharmacy has over the pharmacists is pretty equivalent to what the Medical Society has over doctors. But on the other side, there definitely is an interesting dynamic of how they'll integrate into the healthcare system. There's questions about referrals, how the physician or the provider to provider interactions will go.
There would be protocols and standards in place. MERRILL tells me pharmacists would be required to inform a patient's primary care doctor within a week whenever a pharmacist adds a new medication to the patient's regimen. If the patient doesn't have a primary care doctor, one could be recommended. The pharmacist would also be required to follow up with the patient.
We want to make sure that they're not having any side effects from the medication, that they're not having any other problems. We're not causing any problems by adding the medication.
Potential patients and parents I talked with seem to agree with the coming change.
I think it's a good idea. I mean, it's easier to get to a pharmacist sometimes. It's a lot cheaper as well.
When you have little kids, your time is important. So, yeah, anything to make life more simple and a little bit easier is a good thing.
I think it'd be a really good thing. I think it would, you would avoid the risk of exposing your children to other illnesses in the doctor's office. That's my biggest worry, waiting in the waiting room.
Having a pharmacist write a prescription is not a new concept. This addition just expands the scope of what's currently been in place since the 90s, and it's open to future expansion from the Board of Pharmacy.
The items that are currently on the list that pharmacists can prescribe independently in the state of Idaho are all things that have been researched in other jurisdictions. So they've proven to be safe and effective in other places.
In addition to this recent expansion of what pharmacists can prescribe, the Board of Pharmacy also reduced some regulations. All of this is aimed at increasing access for patients, especially in the rural communities, where they can potentially utilize telepharmacy. The new rule goes into effect July 1st.